I'm Lise Mumporeze. I'm an emergency medicine and critical care doctor from Rwanda. I'm going to present you my leadership project entitled Health-Related Emergency Tips for Parents in Rwanda. As a medical doctor, we are involved in different quality improvement projects as well as taking care of patients, and that's what we do every day. But also as a lecturer, we teach medical students, nurses, but also residents, so that they become the future generation of medical professionals. This is what we do every day, and we feel very much confident about it. However, when it comes to becoming a new mom, the anxiety comes as for any other new mom. We have the same question, like, will our baby ever grow up? Is our practice safe? Are we taking good care of the baby so that they become healthy and strong? Luckily enough, we have our elders who are at home helping us, giving us advice, and we follow them, but sometimes not. Sometimes we are even worried because of our background and what we have seen. For example, there are some practices that they tell you to do, and you're like, should I ask Google or should I follow this? And the anxiety, we wonder if we have this anxiety as mothers and medical professionals. What is the case for a mother who doesn't have any medical background? We also have encountered in our medical practice different life-threatening emergency. For example, I received a baby in hemorrhagic shock who were almost dying because they had cut the tonsils, and that is a very common practice in our settings. Myself, I was always arguing with my mothers about how to sleep my baby. What is the best way to make your baby sleeping safely? Those are different arguments that keeps happening. So that is why we were like considering our traditional childcare habits. What are the risky behavior that everyone should be aware of? This leadership project came based on those ideas, and the intent is to create an illustrated manual on health-related emergency tips for parents in Rwanda. We will first do a survey to identify different practice that can cause life-threatening emergencies, and also what is the practice when a mother encounters a life-threatening emergency such as a seizure at home. And based on the data we have, we will design an evidence-based manual that we will disseminate to mothers who come to antenatal care and then evaluate the qualitative impact. Good enough, we have the hospital that has approved our practice, that has approved our project. We have a core surveying team, and so far we've also done data collection. We have also presented our project to different leaders, and we have some local leaders who already offered to be the pilot in dissemination and evaluation of the finalized project, such as in Rulindo district. We also have an easily scalable project. However, this comes with challenges. This is a very important project to us, but we are running after the clock, trying to meet the deadlines because we have to merge it with our clinical practice. We also want to disseminate this project to Rwanda because we believe this is very important to Rwandese population. We also are asking ourselves if this is important to Rwandese, it can be important to East Africa. So if we could get some partners to help us disseminate it to the whole East African region, it will be good. We also would like to get advocacy at higher institutions such as the ministry so that this project is given value and disseminated. And this doesn't come without a challenge of money, because for us to print, to teach, and move around the country, it requires funding. This is a challenge, but we are committed to overcome it. We've already obtained approval from the hospital. We have finished data collection. We're going to analyze it, and then we will be moving to the third level of designing the manual. As a leader and a medical doctor, as a mother, fueling awareness on safety of our children is our duty to the society. I welcome you to be involved in this. leadership project so that we achieve our goal of safety to our children. Thank you.